Hi, everyone. I'm Steve. I'm here with Dr. Nario, who is at Biointegrative Health Center in Reno, Nevada. Thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure in this snowy day here in Reno.
It is. It's a snowy day in Carson City. Got about a foot of snow. So we're going to talk about ayahuasca. Did I say it right? Ayahuasca. Now, before we get into that, if you want to know more about Dr. Nario, what he does, he's at Biointegrative Health Center in Reno, Nevada. You can look them up online and see all the different things they treat. So, this ayahuasca stuff sounds pretty crazy to me. You said you're having patients ask you about it. So, you're going to talk about it. So, this sounds like kind of fringe stuff to me. I mean, we talked about a couple other ones the last couple weeks that
Yeah, I think, Steve, the hippie revolution is coming alive again, and we don't want to be left behind by our peers here. So we need to educate our people in relation to what's coming around, what's going on. And today we're going to be talking about something that sounds mystical, controversial, and maybe even a little intimidating. It's called ayahuasca. Some call it plant medicine, a conscious expander, a trauma healer, even a spiritual reset. But today we're not approaching it spiritually or politically, but we're going to be asking one simple question. Is there anything about ayahuasca that connects healthy aging and longevity? And so, what does science actually say?
yeah, so because everyone's into this longevity stuff and health span and being healthy for as long as you can, and they're looking all over the place. Peptides, we've talked about peptides and hormone replacement and all these things that people are looking for the holy grail of longevity. And so they're coming up with some pretty, I don't know, it sounds kind of crazy to me, but you know more about it than me. So,
That's
yeah.
what everybody's saying.
So what is it? What is this stuff?
All right. So ayahuasca is a traditional Amazonian brew. It's called Vine of the Soul or Vine of the Dead. All right. So we're talking about woo woo stuff here. It's a decoction traditionally used in the indigenous Amazonian shamanic practices for healing. It's spiritual purposes, made from two primary plants. It's Banisteriopsis capi, or the vine, and Psychotria viridis, the leaf. So they combine two plants together. They create a unique biochemical combination. The leaf contains DMT, which is a powerful psychedelic compound, and the vine contains MAO inhibitors, which allows the DMT, which is the active compound, to become orally active. On its own, DMT is rapidly broken down. Together, these plants create a 4 to 8 hour psychoactive experience. Sure, can it be ecstasy, possibly LSD? So ayahuasca is typically used in, okay, this is what's important, ceremonial settings, okay, not
So
recreational settings.
who's used it? Who has used this in the past?
So in relation to who are the users of this, or maybe the legal users, these are really very limited. So and who are they? So religious exemptions has been given to this specific churches, for example, as the Supreme Court had deemed okay for that, like Santo Dame, I think. The Church of Gaia 2025 DA got gave its approval via petition. So again, narrow, sincere religious use only, not for general medicine or therapeutic retreats. The thing here, though, is people are not doing this here in the US. In the US, it's very illegal. Retreats in the US often operate in gray areas. That's why they go internationally. And this is Peru, Brazil, where legalities and cultural heritage kind of trumps it in order for it to be legally used.
So I'm going to say this is not FDA approved.
No, but you'd be surprised, Steve. I have patients who now this conversation actually was sparked by my patients when they come to me and say, "Hey, I've done this. Is this okay?" So now this is where I come in to actually like explore more about this education for you, the viewers, in order for you to know what's really going on with ayahuasca.
Okay, so what did your research find?
So again, as I mentioned to you about ayahuasca, it's really there are benefits for it. So the benefits here, basically the brain. So the mode of action of ayahuasca is actually through the serotonin receptors, especially or specifically the 5-HT2A. And this is the default mode network of the brain that involves ego, identity, and even rumination. Emotional memory circuits are also involved, but during the experience, brain imaging studies, again, this has gone through studying and studies here in the US, and shows reduced rigid network activity, increases cross communication between brain regions, and enhancing emotional processing. Translation in plain English, it temporarily loosens rigid thinking patterns, it increases emotional access, and enhances neural flexibility. And neural flexibility is highly relevant to aging. And preclinical human studies suggest psychedelics may increase BDNF, brain derived neurotrophic factor, promotes dendritic growth, enhancing synaptic plasticity, and plasticity means adaptability. Aging brains often become more rigid, more anxious, more pattern bound, and more inflammatory. Anything that safely restores plasticity becomes interesting in longevity science, but emphasis usually should be made on safety.
So I'm maybe going out on a limb here, making this assumption that there's some potential negative side effects with this.
There is. So again, when you talk about side effects, ayahuasca is not harmless. So the acute effects of the use of this would be, so you drink this, okay, during a ceremony with other people, and intense visual auditory imagery. So meaning closed eye visions, as you could see this, profound introspection, emotional catharsis, sense of connection and unity, ego dissolution, purging. So this is 70% of the takers of ayahuasca will puke or will have diarrhea. So purging, but culturally, this is viewed as something good. Why? Because purging or cleansing is what it signifies. And psychologically, anxiety, fear during challenging phases commonly seen, but usually transient with support. So the support comes from your shaman who actually is there. He's basically the professional who does this with you. And then mystical type experiences correlates with therapeutic outcomes. And you can also have bad trips. So rare in screen supported settings. So when you have your shaman with you or professionals maybe, and resolve with reassurance. Again, purging is the one that you will usually see when you are taking this. But again, my worry as a clinical practitioner is it can increase elevated blood pressure, dangerous when it interacts when somebody's taking antidepressants, and risks with the people who actually have the diagnoses of, for example, bipolar or psychoses. So this is the part where your shamans or your professionals probably wouldn't know how to assess. So that's why this is probably something that a medical person should probably assist you with rather than somebody who is not, right? And again, screening is really needed by your clinicians. It's a good thing my patients tell me this because I would not advise this for patients who has severe cardiovascular disease, heart issues, even a recent stroke or MI, personal history of again psychosis, schizophrenia, and of course pregnancy and breastfeeding. It has been seen that this is going to affect the fetus in animal models, and of course severe liver kidney impairments.
Wow. Sounds like a lot of things can go wrong. And I guess that's kind of why it's done kind of secretly. I don't know. Maybe I'll just stick with reading the Bible.
Well, the thing here is you pay good money. I've heard people on how much they pay for this, and it involves, of course, it's like a medical tourism type of effect that they're going to travel to these specific countries and they will get this specific service. So again, yeah, doing this is fine as long as you are definitely guided in relation to what you're doing. But our main focus here really is longevity and anti-aging, right? These are the things that where we focus on. So chronic depression, trauma, and anxiety are just not psychological issues. They are associated with higher inflammation, elevated cortisol, accelerated biological aging, and increased cardiovascular risk. And observational human studies have shown ayahuasca is associated with reducing these depressive symptoms, increased psychological well-being, and reduced substance misuse. Some longitudinal studies have shown lower depression scores, greater life satisfaction, no evidence of cognitive decline. So that's interesting but definitive. Ayahuasca may help some individuals process trauma or break destructive patterns, and trauma resolution can reduce inflammatory burden over time. This is where it, I guess, intersects with longevity.
Yeah, it's like It's interesting to me that you have so many patients asking you about things that are kinda off the cuff or, uh, on the kinda extreme because they're really looking for and maybe you can kinda talk to this. It seems like they're really looking for the next great health secret or longevity secret that's gonna make them live an extra 50 years or something. It's pretty fascinating.
Yeah.
So, do you think that that's something that I mean, I don't think it's just your patients. I think it's a lot of people in general are really looking for this secret pill or
Well,
magic
the thing,
formula.
yeah, but the thing, Steve, here is I think where this all roots from is again one of the common denominator that I always hear is the frustration with their current therapies. The current therapies that we offer really they have limitations. They cannot, there's a certain extent your SSRI or antidepressant can only help you with your specific depression. And now with them piling up all with all of these medicines by given by a practitioner, equates to a higher side effect level. And this is where they do their own research. They become more proactive about their health, and they find out that natural therapies are out there. It's unfortunate that it, they don't get guidance. Only guidance they get is like through the internet, your AI, right? The thing here, there are really important things that you need to discuss to these people who are frustrated and wanders around and actually tries to just get the best thing for their health. And that's why when I see them in practice, I'm not non-judgmental in terms of the context effects of what they did. And again, always screen for complications, making sure that all these things that I mentioned are not in their profile for them to, if they try it again, they have to be cautious. And again, with this type of experience, I always kind of say that this definitely will go well with psychotherapy. If you're doing these specific things, there are ways on how conventional methods can integrate with what you're doing and still be helpful. And again, our main purpose here as your provider is harm reduction. We always, again, advise unsupervised activities without vetting or making sure your safety is not assured. And always, we recommend evidence based alternatives first in relation to their choices, in relation to what they seek.
That answer that you just gave was that insight that you just gave is what I was looking for with the question that I asked. So it sounds like there's a lot of people that are frustrated with traditional medicine. You know, you take this drug for this, which caused this. And so now we need to take this drug to fix this. And that drug did this. And now they're a walking medicine cabinet.
Right.
And they don't like that. And they
You
don't
know,
feel good.
yeah, there the thing here is this is not a promotion for ayahuasca. This is actually emphasizing that you have to remember federally the DMT or the active part of ayahuasca is schedule 1 in the US, meaning it's illegal to process, possess, or brew, distribute, again, except for religious exemptions. It's really more of a guidance for our patients. But on a case study basis, I have patients who have done this, and they just said that it was the game changer. It was the pivot point of their health where everything got better, right? So that's why I'm just sharing this story to everyone that there are things out there like this that they should be known about, especially for the anti-aging and longevity crowd that we have.
Yeah, and it's the mentality that interests me and that fascinates me so much. I mean, everyone's different,
Right, right,
and, so some people they're trying stuff that no one would try decades ago, it sounds like, but it's because they're getting, I don't know, a little tired of the traditional way of doing things and those things not working, and you're a biointegrative, you're an integrative physician. So I guess they talk to you about it. And I know you're not recommending anything or suggesting anything. It's just interesting that people, it doesn't surprise me that they're asking you about things like this. And you've always been good about, well, let me dig into it.
Mhm.
And you're right. It's nice that you don't judge people. Yeah, I might have a hard time with that if they came asking me about this stuff. Like, but you're really good at listening to people, I guess.
Yeah, well, again, if everyone, again, even if someone never takes ayahuasca, the science around it teaches us something powerful. The brain remains plastic later in life. Trauma can be processed even decades later. Even rigid patterns are not permanent, meaning making impacts physiology. So healthy aging is not just biological maintenance, it's psychological integration. And ayahuasca really is not what we think about extending telomeres, directly increasing lifespan, replacing sleep, diet, and exercise, making you biological younger overnight. However, it may influence stress physiology, behavioral change, addiction recovery, and even meaning and purpose of our lives. And purpose is one of the strongest predictors of healthy aging. Longevity isn't just our cells, but it's also our psychology.
Yeah, it's very fascinating. So I kind of got off on a bunch of tangents there just because I'm fascinated about what people are asking you and what they're finding out. So I'll just give you an opportunity. You have any last thoughts on this or anything that you want to say?
Yeah, ayahuasca is not a fountain of youth, which I can tell you, but it sits at an intersection. We're just beginning to understand neuroplasticity, trauma biology, inflammation, behavioral transformation. Longevity is about adaptability. And ayahuasca research is actually ongoing and reminds us that aging brain is more changeable than we once believed. So the current research with ayahuasca, it's actually showing up, and this is a randomized controlled trial, I think of 25 people, that it actually is best for depression. So right now, studies are ongoing, and we're onto this. Science is onto this, and hopefully, we can bring more to your table as we move forward.
All right. Well, as always, Dr. Nario, thank you for your insight and bringing this to our attention. And hopefully, your clients will get something out of this or your patients. Thanks for
Yes, well,
being with us.
I know we just have new topics every day as we do this. And again, I want to thank you, as we all know that knowledge is power, and thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.
All right. We'll see you next time.
Thanks, Steve.